health correspondent Nicola Hill, who joins us live from London. Nicola, I find this subject fascinating. Yesterday, I was told to drink tonic water, but there's also talk of drinking hot water. I've heard that many times. But apart from that, there's many unlicensed medicines or vitamins claiming to cure COVID-19. Is this all rubbish, or do any of them actually work?
Well, I think drinking tonic water or hot water will definitely hydrate you, but it's not going to prevent you catching the coronavirus. And this is why the Medicines Agency, the regulatory agency here in the UK, has actually put out a warning to the public, saying that a lot of these so-called miracle cures, which can vary from like a herbal tea or tonic water to actual unlicensed medicines, are to be avoided. There's two reasons for this. One, people might then think they're immune. So they're thinking, fine, I've taken my miracle cure, I can go out, and therefore they can then catch the virus, spread it to other people, and overload the health services. The other danger, of course, is what they're taking is dangerous and it can harm them or even kill them. So, no, I mean, there's no treatment, unfortunately, available at the moment.
Okay.
And these miracle cures don't work.
And I challenge you then, Nicola, what do you do when it's a president that is actually putting out a claim? For example, the president of Madagascar, he's been advising a herbal tea. He even says the tea gives results in 7 days.
It's quite terrifying, this really, isn't it? It's interesting that the WHO has worded a response to this, because I know other African countries are actually importing this herbal tea, which is apparently based on an ingredient that's used in an anti-malarial drug. So the WHO, what they're saying is, we do not recommend self-medication with any medicines against COVID-19 because basically they don't work. We even had the president of Belarus apparently saying that he couldn't see the virus flying around, so therefore have a vodka and take many saunas. Those don't work either. And the WHO has now got a myth-busting page with a whole list of things on it, saying that, you know, these don't work. They range from having hot pepper in your soup, to washing your nose with saline solution, to then, of course, injecting or ingesting bleach. None of those work.
Yeah, especially the bleach one. On that, what are the worst myths about the virus that you've heard?
Well, I think there's the dangerous ones, like you just said, you know, we talked about them with the bleach. Also, that if you have lots of alcohol and if you start taking methanol or ethanol. Now, these are great at cleaning surfaces, but if you ingest them, they're going to damage your organs. The other ones are things like if you try UV light or very high temperatures, is that going to work? No, it's not, and you could burn yourself. Similarly, cold temperatures, sitting in a freezer, something like that. These don't work. All of them are very, very dangerous, and apparently there's adverts in the dark web. So there's a professor of criminology in Australia who's warning about some of the products that are being advertised there. These include apparently blood plasma from patients who've recovered from COVID-19. Now, we know that this is being used in hospitals, and this is undergoing trials effectively because that blood plasma has been cleaned. It's got nothing else inside it. But of course, we don't know what's being sold on the dark web. And of course, there is a danger that any blood that you take from somebody else could have hepatitis, it could have other infections in it. So avoid.
So, Nicola, in a nutshell, go to the WHO website and look at the myth debunking advice there, correct?
Very much so, Maria, yes.
All right, we'll leave it there. Nicola Hill in London, thank you so much.